All right, thanks, Chase. Back pain is a common ailment that can range from a dull ache to a sharp pain, which is caused by a number of reasons, and it can happen to anybody. So here to tell us a little bit more about the different types of back pain is Nurse Christina Paris. How are you today?
Hi, good morning. So this topic is for my friend Connie. I asked her about a topic and she suffers with back pain, and so asked that I talk about it.
Yeah, and I feel like it's something everyone kind of deals with.
Absolutely, there's a lot of people who struggle with back pain.
Awesome, well, can you start off, can you tell me a little bit about what are the different types of back pain?
Yeah, absolutely. Can I use you as a model?
Of course.
Okay, I'm gonna have you stand up just so we can show the different areas.
Okay.
And then if you just turn around a little bit, here we go.
All right.
So we have the cervical spine, which is up in your neck here. Then thoracic, which is the part by your lungs. And then we have lumbar, that's down here. You'll see a lot of people will have like lumbar, spine, things in their car to help with that. And then we have the sacrum and coccyx, which is the lower area. And some of the things that we think about when we think about back pain are muscles. So we have muscles that come and they connect. We have tendons and ligaments, things like that, that will connect to our spinal cord. Thank you, you can turn around.
And I like to be a model.
So we have acute and chronic pain. So acute pain comes on, it's short term. Maybe you just did something to aggravate your back. It only lasts for, a few weeks. Then we have chronic back pain, which lasts much longer. So we're talking more like greater than 12 weeks, or 6 weeks or whatever. It's a long term. People will have it for years, and sometimes we get to where treatments are just really managing pain.
Sure, and then what are kind of like the signs to look out for, if you are at risk for back pain?
Right, so some of the symptoms, of course, you're gonna have back pain. You might have some numbness and tingling in your hands or in your feet. You're going to feel like, just have some weakness, generalized weakness in your back. And so when those things occur, that's when you wanna start to think about how we can treat this.
Sure, gotcha. And then speaking of treatments, what are the types of treatments, to help somebody who is experiencing, whether it be minor back pain or, like you said, chronic?
Right, absolutely. So some of it is just, so for acute, you can try ibuprofen, Tylenol, things like that will be helpful. You can also do heat, rest. Physical therapy is huge for chronic pain too. Exercise can help too. So if you strengthen those core muscles, you strengthen your back muscles, things like that will help. You and I talked about posture.
Yes.
If we work at a computer for long periods of time, posture can be a real issue.
Right.
People who sit for long periods of time. Weight management too. And then there's all kinds of, there's like surgical options that you can have too. There's muscle stimulators or pain stimulators you can get put in. People will use TENS units, which are a type of stimulator. And then there's surgeries to correct the back. I have not met too many people who the surgery was so successful. They were like, yes, I feel 100% better. It's not like a knee replacement or a hip replacement where people are thinking, why didn't I do this sooner? Most people with spinal surgeries, it might relieve some of it, but it's not gonna be a drastic change. And so then you're going to be looking at long-term chronic pain management. There's some medications like gabapentin that can help with nerve pain or sciatic nerve pain. There's also different, you can try physical therapy. It's gonna be pain management at this point. So you want to prevent back pain if you can.
Right.
So if you have a job, like in nursing, we would move patients up in bed and we'd be lifting. And so it was, chronically doing this movement does micro tears. So a lot of jobs, if you work at the lumber mill or you're working in a factory where you're doing a lot of repetitive movement, you want to try to use anything you can to minimize that. Talk to your representatives and the people who work with OSHA to come up with better strategies so that you can minimize your back pain. So preventive is key. If not, there are other options. Cognitive behavioral therapy, things like that can help too. Physical therapy. Yeah.
I never
Massage,
realized,
chiropractor.
Yeah, I never realized how much went into back pain, like all these different options that can help.
Right.
That's so interesting.
And it depends on where on the back,
Sure.
as well as what's causing it. You know, we have these little discs. So we have our spinal cord that goes through the vertebrae, and we have the vertebrae, and in between each vertebrae are these little soft, squishy discs that kind of they're like shock absorbers.
Sure.
But what can happen over time is with these repetitive movements, as you start to kind of push that disc out, and when it starts to bulge or push out of alignment, it's going to push against that spinal cord, and that's what's causing a lot of that discomfort. So it's realigning, which is where chiropractors and physical
Sure.
therapy can come in. So if you can catch it early, you can get your spine realigned, strengthen your core muscles, strengthen your back muscles. You can prevent it, get rid of it. I did have a back injury for 2 years.
Wow.
But I was able to, and I just had to keep trying different things,
Sure.
you know.
And finding what works is
Exactly.
key.
And going back to different treatments, rest. And I was able to get rid of it. I'm really careful now about what I do because I don't want that chronic long-term pain.
Well, awesome. Well, thank you so much
Yeah.
for joining us today. I learned a lot, and I definitely will be using some of those
Good.
tips. Awesome. And we'll be right back with what's trending after the break.